Hello. Today we'll talk about the problems of the Achilles tendon. The Achilles tendon is the continuation of the gastrosoleal muscle complex, which is also known as the calf muscle. It forms a thick, strong tendon and attaches at this prominence of the heel bone here. Achilles tendinitis or Achilles tendinosis is a problem that can happen in athletes and other non-athletes too. There are several reasons for it. The commonest reason could be because of overtraining, doing too much too soon, problems with training techniques, etc. But some predisposing factors like an exaggerated arch in the foot, or a pronated foot, or an inturned foot, or if there's a bow leg problem, all these also can predispose to Achilles tendinosis. So there are two types of Achilles tendinitis or tendinosis. One is what we call as the insertional tendinosis, which happens at the point of insertion. The other one is slightly higher up, about 2 to 6 centimeters from this point, what we call as the mid substance of the Achilles tendon. The term tendinitis refers to inflammation, whereas tendinosis means wear and tear overuse problem. So both these problems initially can start with pain and discomfort after a particular sporting event, after say a game of badminton or tennis, but gradually as the problem progresses, the athlete will start experiencing pain even during play, and in advanced stages they may be unable to play right from the start. Insertional tendinosis can also be associated with two other problems. One is what we call as a Hageland's deformity, which again is an exaggerated prominence that occurs here at this heel bone, and inflammation of a bursa here too, between the tendon and the bone. Inflammation of the bursa can also cause pain here. So tendinosis, which is wear and tear of the Achilles tendon, inflamed bursa, and a bony prominence called Hageland's deformity, all three can contribute for the pain at the insertion of Achilles tendon. So diagnosis is usually based on the clinical history that the patient gives us. Examination, specifically we look for areas of tenderness, investigations, sometimes in just an x-ray should do most of the time. Sometimes we may get an ultrasound or an MRI scan. Treatment is always non-operative at the beginning. We do look at predisposing factors, whether there's an underlying deformity that we discussed, or if there is any issues with the training plan. If there is, they need to be addressed first. Measures like resting, icing, warmth, footwear modification. Sometimes we do give injections, extra tendinism, not into the tendon. After good trial of non-operative management, including physiotherapy, exercises, and strengthening, if all these have been tried for 3 months at least and things are not improving, then we would consider surgery. And depending on the problem, surgery may involve excision of the wear and tear portion of the tendon. Sometimes we may have to remove this pronounced bump called the Hageland's deformity. We can do it either open or by arthroscopic. So how do we prevent Achilles tendon problems? First of all, making sure that there are no underlying abnormalities in the foot and the knees. And number two, appropriate training techniques. Number three, not doing too much too soon, wearing appropriate footwear, and seeking medical attention as soon as a problem occurs rather than delaying.